Thank you, Malika, for that very kind introduction, and thank you for being a host with Google of this very important event, for bringing people together across our nation to talk about important issues relating to incarceration and women, and certainly of men, as we just heard. And we appreciate all that Google does as a good corporate leader and a good civic leader within our individual states. And we are very proud in Oklahoma to have a big Google campus in my state, and of course having a major company like that in our state's a big deal. So thank you for your leadership, and thank you for helping to sponsor this event. Google's also been very active in helping us in my state with young girls and getting into STEM education, the science, technology, engineering, and math, which will go a long ways in helping prepare women to enter into different fields and professions that they may not think of. So we appreciate you. And of course, we appreciate the U.S. Justice Action Network. And Holly, where's Holly at? She's probably working somewhere. But anyone that's met Holly, when Holly asks you to do something, you're probably going to do it. She is such a great enthusiast and great advocate for our criminal justice issues, and we appreciate them. And of course, all the other sponsors that are here today, thank you. We appreciate the Koch brothers and all that they do, and all the other organizations that are part of this. And I appreciate all of you taking time to come to this forum, a first of its kind that we've ever had in our nation, to talk about women incarcerated and what we can do as a nation, and why it's important as a topic to talk about, and about incarceration in general. You know, prisons play a critical role in keeping people who are dangerous, who are violent, who might affect, as Senator Booker was talking about, our own liberty, or our own justice of our families, who might threaten our safety. But there's a large growing body of research that shows that prison is not the answer and the best option for everyone. And I think it's what we just heard Senator Booker talk about a few moments ago. It's not for every offender that we see that comes through our criminal justice system. For many of our non-violent, low-level offenders, there are alternatives that work better, in my opinion, such as our drug and mental health courts that we have established throughout our nation, and something that's very active in Oklahoma, to bring community-based treatment, diversion programs, supervision to work better, and to help people get through whatever it is that they may have done to prevent future crime, and also to, frankly, cause us to use less prison beds within our nation. And there are states that are active in this reform effort. States like Texas, Georgia, South Dakota, Utah, Kentucky, certainly Oklahoma, have designed various policy reform issues and using research to help us when it comes to our incarceration rates, and to control, frankly, our corrections spending in our individual states, because that money, if you're spending on corrections, is being taken away from education or health care or some other important topic. It's also been shown that many states have been able to reduce imprisonment while reducing crime, by ensuring that expensive prison beds are used for those who are actually dangerous, that we need to keep locked up to protect ourselves and our individual families, while also reinvesting in programs that are successful, and programs that help with the ability to reduce recidivism, address substance abuse, address people who go back into the system itself. And so I want to share with you just a couple of statistics regarding women incarcerated in my state of Oklahoma. Now, the reason why I've been interested in this, and I was telling Malika this and some of the other folks I had dinner with, that as a young girl growing up, my mother was a social worker. And there were times at night that she would get a phone call when I was very young, and they would say, you know, Mrs. Copeland, you need to go pick up this child because something's going on in the family. It might have been a domestic abuse situation, or maybe it was someone who had been arrested and was being taken away, and this child was left behind, and so my mother would go pick up this child. And I can remember at times having to go with her because my father would be gone somewhere, and I'd ride in the back seat and she would go pick up this child, and this has been a long time ago, and would take them to some foster home or some group shelter type home to get them safe. And as a young girl who had a safe and loving household, it really had an impact upon me, thinking about not all children have the safe household that I had and that I enjoyed. And then as I became governor and started working with our Department of Human Services and our women who have children that are in foster care, and seeing that we have over 11,000 children in our state that are outside their home and that are living with a foster family or in state custody, and then looking at our incarceration rate of women in prison and men in prison, and seeing how all of it ties together, it really became an issue that piqued my interest, that we have to do something about this. As coming from a mother who was a social worker, to seeing children being put in state custody and the cost of that upon their lives and the uncertainty about their future, to just how many women we incarcerate. Oklahoma, unfortunately, has the dubious honor of having the highest incarceration rate of women in the nation. And that is not something I'm proud of. And so for years I've had various studies in which we brought together people to say, why is it that Oklahoma women are being incarcerated at a higher rate than other states of the nation? I've jokingly told crowds, I said, we don't have meaner women in Oklahoma. We just have some that have some issues, whatever it might be, that end up in our correctional facilities. But the fact of the matter is, even though we've focused on this issue, the gap has continued to widen of female imprisonment in our state. And since 2012, and I took office in 2011, it has actually increased by 30%. And part of it involves, as far as reducing the rate of incarceration, the rate of women entering into our system, is part of it involves programs, diversion, treatment, community programs and sentencing, but also educating those who are in law enforcement or in the criminal justice system itself that there are other ways to be able to address people who have issues within the criminal justice system. We also know that a vast majority of women who go into our prison system in Oklahoma are there for drug-related crimes. But there's been this attitude, it seems like to me, in our nation, that if someone has an addiction issue, let's just put them away, lock the door, they'll get out someday, it'll be resolved. And my experience tells me that doesn't always work that way. I think all of us, in fact, let me just ask this question. Does anybody in this room not know someone that's had a substance abuse related issue? Anybody not know anyone? From high school, from college, someone that you might have worked with, someone in the community. Anybody not know anyone that's not had a substance abuse issue? I've never had a single person raise their hand and say, I don't know anyone. I've never had anybody raise their hand and say that. We know that 83% of our female prison admissions in our state are for non-violent offenses. We know that 42% of our women in our prison systems in Oklahoma have a drug-related crime, a drug-related conviction. Women are also that are in prison are also more likely to be assessed for having substance abuse issues and problems more than males. I don't know why that is, but we know that in our state. 69% of our women in a prison in Oklahoma have had an actively managed mental health issue. In other words, they've been under active treatment for some type of mental health issue or a serious mental health issue, compared to 44% of the men. I don't understand that either. In Oklahoma, a large percentage of our women in prison have been victims of crimes themselves. As I've talked to women who are in our prison facilities or in our work release programs, or as I've even looked through the jackets of people who come to me for a parole or a pardon, and I read through the background material on women who have entered into our systems, you do find that a large percentage of the women that end up in our prison systems have had some type of domestic violence, sexual assault, or even been abused as a child themselves, and find that generational psychological trauma that follows them into their adulthood. But there are some good things that are happening in the states. The Senator talked about some things that are happening on the national level to address our incarceration issues, but I want to tell you about some of the things that we can do on a state level, and Oklahoma is just one of the states, but we are very aggressive on this issue. We have been working with our Department of Mental Health Substance Abuse Services to prioritize treatment for services of women who are pregnant, for women who have children, and provide those services in a targeted way to meet their very special needs. So we have different residential treatment facilities in which pregnant women can enter into and work with their family and living arrangements, and especially women who have dependent children. We also have a limited edition of community-based substance abuse treatment programs, specifically for women with children. Since I've been governor, we've also been able to provide more funding for 3 more statewide crisis intervention service centers. What we found in our state was that if someone entered into a crisis situation, especially with substance abuse or mental health, that they were being transported across the state to many other different facilities, trying to find beds, trying to find space, only be told many times that the space wasn't available. And so we allocated more money to have more crisis centers into our state to meet their needs. Our Department of Mental Health has also been a leader in providing services for children and families in what's called a system that we have. It's called systems of care. We know that when someone has a challenge within their life, that it's normally not just one issue that needs to be addressed. It could be many different issues that need to be addressed. So we have a system of care to where not only do they enter into the corrections agency itself, but we engage multiple state agencies such as mental health, substance abuse. If you have a woman that is entering into the criminal justice system, they may have a juvenile at home, could have some family members that have their own issues, so we work with that woman and the mother to also address their juveniles within the system and see how we can provide them support. We work with them with the Department of Human Services if their children are going into the foster care system. And we also work with our State Department of Education. What happens to the children when mom goes away and they're still in school and they still need to get to school, they still need transportation? So we try to develop this system of care to take care of all the different needs of a woman that is in our criminal justice system. We've also developed some very, very successful partnerships, public-private partnerships versus just sending someone to prison and saying best of luck and work it out and we'll see you whenever you get out. One of the great programs that we have is a program called Remerge, which is a comprehensive female diversion program designed to help transform pregnant women and mothers facing incarceration, to help them not go into the system, to be able to stay out and get them the services that they need, by having a partnership between our Department of Corrections and our mental health services to reduce the rate of the women that are incarcerated and to interrupt whatever it is that's going on in their life, and to interrupt what I would call the generational cycle, intergenerational cycle that we see of women and families and children. Because a lot of the different reports I've read on women who are in our systems have a grandmother or a mother. If they're in line, their child's in trouble too. And so we're trying to break that cycle, whatever it is that's going on in their life, by providing those systems of care, those systems of services to help them get on the right path. We also work very much with evidence-based programs, not just a program, but things that we know will work. One of my favorite sayings is that we want to put people in programs that we know work, not in programs that we just hope will work, but that we know will work, that are proven. Whether it's addressing the mental health, behavioral health, trauma, substance abuse. And then upon completion of the Remerge programs, the graduates have an extraordinary opportunity to have their felony charges dismissed. Gone. Another great successful program that I'm very proud of is a program called Women in Recovery, which is also an intensive outpatient alternative for women facing long prison sentences for nonviolent drug-related offenses. And this initiative works very closely with our criminal justice system and various community partners to ensure the program participants receive supervision, substance abuse treatment, mental health services, education, be able to finish the GED if that's not been finished, help them with workforce-ready training programs to help them have some type of skill that they can use. And then, of course, the most important thing is the family reunification, putting the children back with the mothers, helping the mothers be able to reunify with those children. And, of course, the benefits are broad in this program. It helps strengthen the family network, strengthens that individual, strengthens the children, hopefully will break the cycle of the intergenerational incarceration, and helps women become productive tax-paying citizens. restores, hopefully, their hope and their self-worth, and is certainly more cost-effective than the incarceration into our prison systems. And we believe it actually improves public safety because you're helping someone get back on their feet. Last April, we did something very innovative in our state. I actually signed a contract that we had that was allowed by law called Pay for Success. And basically what the state did is that we're partnering with this Women in Recovery program to pay them for every single person who goes through the program that successfully comes out of the program, stays out of trouble, stays clean, but we pay for success for that program because it's such a great model and keeping our ladies out of prison but helping them get the treatment and services that they need. And I'm very excited that we were able to do that. It's one of the first of its kind in the nation to partner with a private entity to be able to help us with women, keeping them out of the system. We know in the state of Oklahoma that it costs around $30,000 a year to incarcerate a woman, but when you put them through a Women in Recovery or Emerge program, it is a lot less because they come out in a shorter period of time and it's less expensive as a program. Plus they're getting the treatment and the help, the education, the work skills, the family socialization skills that are needed. Another great program that we have is called HERS, H-E-R-S, her program, which is targeted to female offenders who are facing technical violations. We had a long discussion about this last night, about people who have been in our corrections facilities that come out that maybe have a fine or a fee or a technical violation, maybe have a revocation of their probation, and where women are having to choose between paying for different services that they need, food, water, whatever it might be, or paying for their fines to keep out of prison. So we're working on ways to address people not going back into the system because they can't pay their fines and fees and having a revocation of their probation on their services. So we have a lot of different programs that we're doing. We also have screening programs that are evidence-based, that we screen women for their needs. We do an assessment of what is going on, and then we match the offenders with successful diversion programs within their local communities. And we look at the more higher risk intensive supervision that may be needed, higher treatment needs of some of these ladies for more intensive treatment options and diversions that will help, diversion programs that will help them stay out of the system. And this systematic risk assessment has really been successful, and we've been able to reach down into our county jails before they even enter into our correctional facilities and do these needs assessments and screenings so that hopefully we can put them into community-based services and treatment facilities and some of our nonprofit programs I just mentioned so that we can keep them from entering into our corrections facility themselves. So we've had about 6,000 female offenders who have been screened within the past 4 years in our county jails, and those final dispositions and the screenings have been able to keep 90% of these women out of prison. 90%. So it's another great program that we're very, very proud of. The other thing we've worked on that I think is a great need is also to have collaboration, cooperation, communication, education to better help work with our prosecutors and our defense attorneys. That has been one of the great needs that I have seen, and so we have been working with them to provide information, provide evidence-based programs, solutions, information. We've been working with them to process cases quicker through the system so that so that the offenders will have fewer jail days, be able to be matched with the appropriate services. We've had a broad-based push to use drug courts in our state, and they've been there for a long period of time. And we also know that people who go through the drug courts and are graduates have a lower rate of incarceration compared to people who are released from prison that may enter back into it. We have about 4,000 active participants statewide at any given time in 58 counties of our state that are going through our drug court systems. And over the last 10 years, nearly 7,000 women have been admitted to a drug court program. hopefully diverting them from going into the system itself. But the other flip side of the coin is it saved the state of Oklahoma $885 million in prison costs, which is a lot of money. In FY16, we had 654 women admitted to drug courts, which saved the state a lot of money. We also have our mental health courts in our state, which is another highly successful program with incredible outcomes. The mental health court serves more than 150 female admissions annually, and only 3.2% of the program graduates end up incarcerated, compared to 23% who will end up incarcerated if they don't go through the mental health court programs. Another great service we have is family drug court programs, which is a little bit different than the drug courts because we bring in the whole family. As you know, if someone has a substance abuse issue, it affects all the family members. And this has been very successful in helping families be able to regain custody, put the families together, heal the family as a whole. Now, after someone leaves our corrections facilities, we also have a reentry intensive care coordination teams that work with our mental health and our Department of Corrections to help with transitioning. Once you leave a correctional facility, offender leaves a correctional facility, they have a lot of challenges, as the ladies know. It's not easy. So this group works together to help provide counseling services, mental health services, works to help provide the types of things they may need, which is getting a job, finding a place to live, transportation, getting the kids back in school, and different types of clothing, different types of services like that. And the reentry intensive care coordination teams have resulted in 43% lower return to prison over a 36-month period following a release. A 43% lower return to prison, which is quite substantial. Now, this is pretty interesting. So those people who go through this reentry intensive care program and get the help after 24 months of being released from prison make 56% more money than someone who just was released without the care and without the help of entering back into society. And of course, they become taxpayers, which is nice and helps them also with supporting their families. So Oklahoma's been working very hard on these types of things, but one of the things that we see with people who are coming out of our correctional institutions is if you've been in prison for a while, your work skills have certainly been challenged, and so we work very closely with our vocational schools, our career tech schools, to provide training for our female offenders, and we have 3 different facilities in our state that we have for corrections, for females in the corrections system. And so these training centers, VOTEC schools, go into these centers and offer all kinds of job training skills. They teach computer fundamentals, they teach career readiness, transportation, logistics, different occupational fields that someone may be interested in going into, because that's one of the biggest challenges that you have if you come out of the system is finding a job, finding a work skill. And talking about finding a job, one of the things I did as governor a couple of years ago through an executive order was on all state employee applications for someone applying to get a state job, I signed an executive order to ban the box on our state applications. So that we don't have that box that someone may look at the application and says, well, they've served some time, so I'm not going to even talk to that person. But to give a person a chance to be able to come and explain what their situation might have been as they enter into that. So the centers that have the career tech skills, job placement rates, they have a 90% placement rate of all the graduates that go through these workplace programs with our career centers. 90% placement of the offenders who are coming out of the system. So that is a great help to those who have been in the system itself. So let me just talk to you real quickly, and I'll close with this. So for the past 4 years, we have been working on criminal justice system issues in our state, trying to find solutions to be able to reduce the incarceration rate of women. We're number 2, by the way, in the nation on incarceration of men and women. It's something that's been going on in our state for decades. We have authored various pieces of legislation This past year, I had a criminal justice task force that worked for about 16 months on various pieces of legislation. We were able to get many pieces of those legislation signed into law, but I had a big battle. That's where I thought you were going with the lioness issue. I had a lot of battles this year, which I think they were tracking all the fights I was having with some of our legislators that didn't want to do some of these different reform efforts. We also sent 2 ballot initiatives to the vote of the people, in which they approved them by around 65% of the vote in our state, which means that our public is starting to understand that there are better ways of addressing these issues. And these ballot measures provided changes which included simple possession of controlled dangerous substances to change it from a felony to a misdemeanor with our inmate population. We also changed some of our property crime limits from $500 to $1,000, so it wouldn't be a felony, but it would be a misdemeanor. And that has gone a long ways. And that was the public voting on those particular issues and helped out. In 2017 legislative year, we also passed a measure that required all offenders to receive a validated risk and needs assessment to help guide our providers into programs that offenders are going to need, and also develop an individual case plan for each individual, not just a broad-based spectrum of plans, but to look at that individual, look at their needs, do an assessment, and develop a plan to help them be successful. Another piece of legislation we passed would work with law enforcement and education relating especially to domestic violence and how to deal with offenders who have had domestic violence in their background and victim safety prior to the pretrial stage. And finally, a bill that provides training for public defenders and district attorneys and judges that would provide them more information, factual, substantial, proven data on substance abuse, behavioral health, and its impact and dynamics upon those who are going into our incarceration system. So as you can see, we've done a lot in the state of Oklahoma. It's a big issue for us. We're not proud of being #1 in the nation on incarcerating women. We have great women in our state, but there are many challenges within the system itself. If we don't, in my state, address these issues, it's estimated that over the next 10 years that we're going to see an increase in our prison population by 25%, that we will have to build 3 new prisons. It will cost the state $2 billion. And so that is why I have been out talking to our legislators and our public to say, you know, is there a better way of being smart on crime to keep people who are dangerous and might cause us harm, that are violent, keep their beds in place for them, they serve their time, but those who have substance abuse, mental health issues, that are low-level offenders, non-violent offenders, are there better solutions, partnering with our communities to be able to find the right type of treatment to keep them from going into incarceration so they can put and keep their families together, be productive taxpayers in the state, have the life that they certainly should enjoy, but yet also get the help that sometimes people just need in times of crisis in their lives. So thank you for having this summit here today. I think there are great solutions that have been discussed, and I think all of us may be familiar with a statistic, and this goes back to Malika to why did I get involved. We know that children who may have a parent that's incarcerated are 5 times as likely to enter into the criminal justice system because their parent has been through that system and the brokenness that comes with the family. And I think there is a way that through smart on crime policies and solutions that we can break that intergenerational cycle of children following in the footsteps of some of their parents, grandparents, to not enter into the system and to produce a healthier society for our state and our nations. So that's why I fight the fight. Thank you so much.